Imagine walking into an ER for a simple blood test that costs $12 to run, and walking out with a $6,000 bill, not because you received exceptional treatment, not because a life-saving procedure was performed, but because the hospital charged an invented price. The insurance company played a make-believe negotiation game, and you, like millions of Americans, got caught in the middle. Here's the uncomfortable truth. The United States doesn't have a healthcare system. It has a healthcare business model. But because the hospital charged an invented price, the insurance company played a make-believe negotiation game, and you, like millions of Americans, got caught in the middle. Here's the uncomfortable truth. The United States doesn't have a healthcare system. It has a healthcare business model. 1. The price is fake and designed that way. The United States is the only developed nation where medical prices aren't real. A $12 lab test becomes a $6,000 charge because hospitals inflate every line item to play a negotiation game with insurers. They bill 10x, 20x, sometimes 50x more, then offer the insurer a special discounted rate. But if you're out of network or uninsured, you get the full fake price. This isn't an accident, it's the business model. 2. The system is fragmented beyond logic. There is no unified system, only thousands of plans, codes, networks, and rules. This fragmentation creates an invisible monster: bureaucracy. Hospitals in other wealthy nations spend around 10% on administration. In the US, 40%. Not on medicine, not on surgery, not on equipment, on bureaucracy. Every extra form, every extra code, every extra rule becomes another cost passed to the patient. 3. Denial is a strategy, not a failure. American insurers deny 16% of all medical claims. Some deny over 30%. And it's getting worse. Medicare Advantage denials jumped 56% in a single year. Why? Because fewer than 1% of patients appeal. It's cheaper for insurers to say no, and statistically, you'll accept it. Every denial is profit. This isn't car insurance. These denials decide whether a human receives care or not. 4. Paying per procedure creates excess. In the U.S., doctors and hospitals are paid per procedure. Every test, every scan, every step is a billable event. The incentive isn't to cure you, it's to do more things to you. Add America's fear of lawsuits, where missing a diagnosis can end a career, and you get a culture of over-testing and over-treatment. More procedures, bigger bills, same outcomes. 5. Lack of access turns small problems into catastrophes. Without universal coverage, millions avoid basic care because of cost. A $120 appointment becomes a $60,000 emergency surgery 3 months later. Preventive care is cheaper everywhere in the world. But in the U.S., insurers have no incentive to invest long-term. People constantly switch plans. Why invest in a patient you won't keep? The system wasn't built to prevent. It was built to repair, which is far more expensive. 6. Costs are shifted to those who can pay. When hospitals treat patients who can't pay, those losses are silently transferred to everyone else. About 30% of medical debt is never collected. So hospitals raise prices on those who can pay, and insurers raise premiums. The result? Everyone pays more, even those who always pay on time. 7. America's doctor shortage, manufactured on purpose. The U.S. has one of the lowest physician ratios in the developed world, 2.6 doctors per 1,000 people versus a 3.7 average. Why? Because decades ago, the American Medical Association lobbied to limit medical school seats, restrict residencies, and cut funding, fearing a physician surplus. This artificial scarcity raises physician salaries and skyrockets patient costs. 8. Hospitals and clinics became monopolies. Private equity took over American healthcare. Hospitals merge, clinics consolidate, independent doctors disappear. When one group controls a city, prices explode. Research shows gastroenterology, plus 118%, obstetrics, plus 116%, dermatology, plus 113%, quality doesn't improve. In many cases, it gets worse. More infections, more complications, even higher mortality in nursing homes. Because when patients have no alternatives, the market stops being a market. 9. Insurers are vertically integrating and silently taking control. United Health already employs 10% of all doctors in America. When the same company controls your insurance, your doctor, your clinic, your pharmacy network, it decides the price, it decides the rules, it decides your access. You don't stand a chance in that negotiation. 10. Drug prices are out of control for one reason: no negotiation. Every developed nation negotiates national drug prices, except the United States. By law, Medicare cannot negotiate directly with pharmaceutical companies. The result? Americans pay more for the exact same drugs, sometimes tens of thousands more per year. A leukemia drug like Gleevec costs up to $90,000 more annually in the US than abroad. The excuse is research costs, but pharma profits remain enormous, and payments to doctors keep rising, doubling from $6.5 billion to $12.8 billion in a few years. The incentives are crystal clear. 11. The system rewards sickness, not health. Everything in the American healthcare model pushes costs upward. Fake prices, consolidation, bloated bureaucracy, strategic denials, high drug margins, artificial doctor scarcity, lack of prevention, opaque billing, vertical monopolies. Costs keep rising, outcomes keep falling, life expectancy drops, and unless you're wealthy, the system doesn't protect you, it protects itself. The United States spends more on healthcare than any nation on Earth, by a massive margin. Yet Americans live shorter lives, face higher bills, and struggle with medical debt at levels unthinkable in any other developed country. The truth is simple. American healthcare isn't broken. It's working exactly as designed. Just not for you. And until the incentives change, the prices won't change either.